AAPC DC 2025 CEUS. Under the ADA, how must medical information collected for an employment accommodation request be handled? A. Stored in the employee's general personal file alongside each or documentation. Shared with managers and coworkers to ensure workplace fairness. C. Stored separately from personal files and patient medical records with limited access. D. Protected only if the employee has also filed an FMLA request, which accommodation supports a professional with sensory sensitivities during APC certification exams. A closed captions B. Private room C. Lecture recordings D. Vision board. What is a key requirement for a diagnosis on the problem list to be valid for risk adjustment purposes? It must be included in the patient's medication list. B. It must be copied from the previous year's visit. C. It must be addressed during a face to face encounter and supported by documentation. D. It must be reviewed by a billing specialist before the claim is submitted. Which statement best describes the direction a 2026 proposed in PMPFS rule concerning on telehealth? It focuses on flexibility in emergencies. B. The majority of telehealth rules still apply to only pandemic measures. C. It is set to build a sustainable telehealth framework outside of emergencies. D. None of the above. Which federal legislation prohibits discrimination against individuals with disabilities in public life and requires reasonable accommodations for them? ADAB, Civil Rights Act of 1964C, Privacy Act of 1974D, RA 6725. Which of the following scenarios is covered by the HIPAA Privacy A? An employee submits medical records to HR to request ADA accommodation. B. An employee visits their employer's on site primary care clinic for medical treatment. C. An employee provides medical documentation for FMLA leave. D. An HR manager reviews an employee's fitness for duty evaluation results. What is the reason for incorporating remote staffing in a healthcare organization? A. Outsourcing. B. Optimization. C. Redistribution. D. Expansion. True or false? Relying on your healthcare providers to collect and house all of your medical information is the best way to manage a comprehensive medical history. A true. B. False. How much did the DOJ recover in healthcare settlements and judgments in 2024? A. $10 million. B. $21 million. C. $1.5 million. D. $2.92 million. Which new AAPC program turned out its first group of graduates in March 2025? A. Mentorship Program. B. Emerging Leaders Program. C. Practico. D. Job Ready Program. What does RAC stand for in healthcare? A. Review Audit Compliance. B. Reassessment and Confirmation. C. Recovery Audit Contractor. D. Relapse and Comorbidity. Which of the following best describes a recommended strategy for maintaining a high quality ambulatory problem list? A. Auto populate diagnosis into the note from the problem list to save time. B. Remove all chronic conditions older than 1 year. Use vague labels to allow flexibility for future documentation. D. Assign trained staff to reconcile the list using clinical documentation and MEAT criteria. True or false? CMS wants to allow direct supervision to occur virtually on a permanent basis now that the pandemic rules are ending. A true. B. False. Ureteroscopic lithotripsy is typically used in what circumstances? A. When the patient is 25 years or younger. B. When the patient is ineligible for ESWL or has complex calculi. C. When the patient has non-obstructing single renal calculi. D. When the patient's renal calculus is obstructing the urethra. What HCPCS level I add-on code did Medicare implement in 2021 to cover the resource costs for? At G2213B, G2067C, G2086D, G2088. How many elements are included in effective to compliance program according to the OIG? A 2B, 5C, 7D. 10. How should medical facilities work to remain compliant until further guidance is issued regarding HCPCS level II? Code C9761. Avoid using C9761 completely until guidance is issued. B. Use C9761 exclusively until further guidance is issued. C. Create internal policies and query providers when documentation is unclear. D. Refer patients with complex calculi cases to other facilities for treatment. A patient goes to their ophthalmologist with a complaint of blurry vision. The physician determines that a secondary cataract is causing the patient's blurry vision, and this could be resolved by performing a YAG capsulotomy. The physician decides to do the laser procedure the same day in the office. What modifier is used on the office visit? A none the office visit should not be billed B. 25C 57D. None the modifier goes on the procedure. Leveraging a remote workforce can lead to what benefit? A trimming of up to 60% in labor costs. B. Shedding expenses tied to physical infrastructure. C. Scalability of staff. D. All of the above. A patient has wet age related macular degeneration in the left eye, and their retina specialist injects 2 mg of Eylea monthly for treatment of this condition. The patient also has dry age related macular degeneration in the right eye, which the retina specialist monitors on a regular basis. The patient is due for an injection in the left eye and a 6-month follow up dilated exam for the right eye. The patient comes into the office, both eyes are dilated and examined, and the doctor injects Eylea into the left eye at the same visit. What modifier is used to get the EM visit paid? A none the office visit should not be billed B. 25C. 57D. None the modifier goes on the procedure. Thank you for watching my video. Please like, share, and subscribe.